As a dental hygienist, we've all seen the amount of trash bags left at the end of the day. Between gowns, barriers, wipes, all of the things that we use to keep our patients safe and to keep us safe, it is essential for us to start thinking about sustainability. It might seem impossible in dentistry. However, today I'm going to be talking just about a few small little changes or things to think about in order to increase your sustainability and decrease your environmental footprint. Stay tuned. Hey everyone, welcome back to the Grow RDH podcast. My name is Katie. I'm a hygienist from South Dakota, and I like to talk about all things dental hygiene. Today on the podcast, we are talking about sustainability and why it's important, why we all should really be starting to think about it. And I'll also share with you in the description some of the articles that I'm going to reference, both from the CDC, RDH Mag, and some of the places where I found this information. I am not an expert in sustainability, but I do think it's important, and I have come up with some tips to help you in your path towards environmental friendly options. First, if you're new here, thank you so much for tuning in. I hope you enjoyed the episode. I appreciate the support, and if you valued this content, please don't forget to like, share, subscribe. We put up new episodes on Fridays, and the content ranges from Cal and Perio to sustainability, and next week we're going to be talking about trauma-informed care. Trauma-informed care is kind of one of my passion points, so I'm excited for that, but sustainability is exciting as well. So let's get right into it. I said I was going to share 5 tips to help you become more mindful about your environmental footprint. As I said in the intro, dentistry is so hard, right? There are a lot of regulations and requirements that we have to do in order to keep our patients safe and us safe from cross-contamination, bloodborne pathogens, all of the scary things that happen in healthcare. But that doesn't mean that there aren't ways that we can look to potentially reduce the amount of footprint that we have. So we're just going to get right into the 5 ways. The first thing is to think about your PPE. There are some sustainable PPE options that we can look for when we're choosing products. And it is an important topic. The ADHA did recently come out and say that all dental hygienists should be trying to preserve natural resources in order to show concern for our natural environment. One of the main problems with PPE is that most of them are made with plastic, specifically polypropylene. And the downside of polypropylene, while it does protect us and it gives us these good quality PPE that protects us from airborne pathogens and blood spatter and aerosols, polypropylene products are very difficult to recycle. They have really long half-lives, and the breakdown of them actually contributes a lot to greenhouse gases. It's almost 15% of the global carbon load, which is quite a bit. Considering how much we use plastics, it's important for us to be thinking about when we are choosing a product, what is in it. Recycling is also an issue. It is very difficult to recycle polypropylene, and only about 1% of plastics is actually recycled because of the high cost of processing. So my tip for you in looking at your PPE is looking at your options. There are some biodegradable options when it comes to masks, looking at the ear loops and what the ear loops are made of, looking at options that could be biodegradable. And another big thing that I know we use a lot at the school is gowns. When I work at the DOC, we do have the option to have a reusable gown, a gown that we launder, or just wearing a lab jacket and having within your office an option to launder it right there. Choosing to launder your PPE instead of using disposable and throwing it away will really reduce your waste. The second tip has to do with the cleaning supplies we choose and when we choose to use them. As the CDC points out, there are multiple layers of cleaning that we do, right? And the most benign layer, I guess, would be cleaning, right? We want to clean the surfaces in our offices. We also disinfect surfaces in our office. And then there's sterilization, which is the full spectrum of, completely cleaning. But I think what we get in the habit of is, for the sake of ease and time and just hassle of dealing with multiple chemicals, sometimes I think we choose the highest strength chemicals because we know that it's good for things. And sometimes this isn't even good for your equipment, right? Using really strong products like on your chair is not a good thing because the leather or the material that your chair is made of might break down. So my recommendation is to look at your office cleaning duties and your cleaning tasks and make sure that you're choosing the right cleaning product for that specific task. If it only needs to be cleaned, then you probably don't need to be using a cavi wipe on it. A lot of the times soap and water will do. And that brings me to my next point under this category, is choosing low volatile organic compound cleaners. High VOCs are air pollutants. And when we can choose a low amount of VOC products, that reduces the amount of air pollution within the area that we're working, which is good for us and it's good for the environment. So again, this comes back to being mindful. We want to be mindful about the specific tasks that we're doing in the office, and it really involves a lot of judgment. So get your team together and go through the surfaces in your office and make sure, or make standards, policies, procedures that show and teach everybody in your office what cleaners to use on what specific surfaces, whether or not they need to be cleaned, disinfected, or sterilized. I want to stress here, sustainability doesn't minimize the need for cleaning. It just means that we want to be more mindful about where we use our products at. The next tip I'm going to talk about is mindful sterilization. We know that we don't want to overfill our autoclaves. However, when we underfill our autoclaves, we are using energy and water in excess. Now, I know the comments already. Totally understand if you are in the middle of a surgery or a procedure and or you have an emergency come in and you need to put something in the statum, or you just absolutely need to run the machine for the patient. I totally get that. But in our everyday work life, I think it is possible to plan ahead. This means that we don't run the sterilizer when it's only partially full. Maybe we're going to wait for the doctor to finish this procedure here so that way we can make sure that the autoclave is full when we run it. Another tip is that we don't want to have to reprocess things. And so making sure our bags are closed the correct way, making sure our cassettes are wrapped the correct way, will avoid our unnecessary reprocessing in certain cycles to make sure that we're only running the amount of times that we absolutely have to. My suggestion to you would, as an office, be to track your sterilization use. You could even have a checklist right on the sterilizer that's like full cycle, half cycle, or how many times you're running it a day. And even if you could reduce the amount of times that you're running your sterilizer, that would still make an impact. The fourth tip is to choose steam sterilization over chemical. I think that a lot of offices have gone away from cold sterile, I think. I know in my area and at the school, we do not use cold sterile at all. But I do know that there are some offices out there that are still using cold sterile. When you compare the two, steam autoclaves are way more sustainable when it comes to environmentally friendly practices than chemical immersion is, and that has to do with the chemicals that are required to use chemical immersion. Steam is only going to use electricity, heat, and steam, versus chemical immersion, which is very high level disinfectant and can be very toxic. The outcome of using chemical immersion is that you do have a lot of chemical waste when you're done. And what do we do with that chemical waste? Probably pour it down the drain, which is not good for the environment. And it's just really not a practice that is necessary anymore, especially with the tools and the autoclaves that are available now. So if you are still using chemical immersion or cold sterile, I would challenge you just to reconsider. Look at other tools, look at other options in terms of changing up your workflow just to reduce the amount of chemical waste that you're producing. Finally, my last tip is very similar to the PPE and the gown switch, but it is to look at finding reusable products versus disposable products. One main example is your air water syringe, right? Using a metal sterilizable air water syringe is going to reduce the amount of plastic disposable water syringes that you're going to be throwing away. This could also be high volume suction tips, right? There are metal versions of those suction tips that you can sterilize over and over and over again and not be throwing that plastic away. Some other options would be bib clips, trays, barriers, and again, your gowns. Not only is this going to help your sustainability practices, but it can actually financially help you as well. Purchasing a more expensive reusable item up front can actually save you money on the long run because you're not continually buying disposable products over and over and over again. It's a purchase once and keep until it's broken. Most of these products can be sterilized in the autoclave, so there's no risk of contamination if you do it properly. So my challenge to you is to maybe find one thing in your office that you could transition into being sterilizable. And what I think you'll find, I know in my case, that as you do these things, you're just like, why didn't we do this a long time ago? This has saved us so much money. You're gonna run the autoclave anyway. Why not add a bib clip in there? So there you have it. There are 5 tips to help with your sustainability practices in your office. This helps reduce waste, it helps protect the planet, and it helps reduce the amount of crazy chemicals and carbon load that we are putting out into the environment. If you've made some of these swaps and you would be interested in sharing, please comment down below which of these swaps you made, how they've helped you, and help the community grow better sustainability practices. These 5 tips can be found in my new planner. If you're new to the podcast, I sell a dental hygiene planner. This planner is designed by me for you, the dental hygienist, and it has a bunch of extras in it. And the month of April, Earth Day, is sustainability. So here's a little sneak peek. All the tips are here and the links and the resources are down below. I highly suggest you check this planner out. I have it for sale on Etsy and it is completely designed by myself. There are other months in here as well. There's a month all about clinical attachment loss. And there's a month all about perio diagnosis, staging and grading, all the tips, and so much more. Thank you so much for listening today. If you liked this episode, please consider sharing it with another dental hygienist or share it with your whole office so everybody can start the conversation towards sustainability in your practice. I appreciate you guys, and I will see you on the next episode. Next week, we're going to be talking about trauma-informed care. And as I said in the beginning, that is something just kind of near and dear to my heart because I am an ACEs trainer. ACEs is Adverse Childhood Experiences. And we teach our dental hygiene students ACEs and trauma-informed care at the school. So it is just something that is really important, especially nowadays as we understand more about trauma and how it impacts the dental patient and how it impacts us in general. So I'm really excited for next week's episode as well. I hope to see you there. Don't forget to subscribe, and I will see you next Friday.